You are the nurse taking care of a patient newly diagnosed with ovarian cancer. Which of the following biomarkers is typically followed to assess the progress of disease, or response to treatment, in ovarian cancer patients? A. BCR, ABL. B. c-Kit. C. Prostate-specific antigen, PSA. D. Cancer antigen 125, CA125. E. Cancer antigen 199, CA199. The answer is D. Cancer antigen 125, CA125. CA125, also known as mucin 16, is a glycoprotein that is found to have elevated serum levels in patients with a variety of cancers, including ovarian cancer, and benign conditions, as compared to patients without such conditions. As a result, monitoring California 125 levels can be used as a method of tracking disease progression or response to treatment based upon what the initial CA125 level is at the time of diagnosis. On the other hand, the other choices are incorrect. Cancer antigen 199, CA199, is incorrect as this is a biomarker in pancreatic cancer, not ovarian cancer. Prostate-specific antigen, PSA, is incorrect as this is a biomarker in prostate cancer, and other prostate conditions, not ovarian cancer. c-Kit is incorrect as this is a biomarker in gastrointestinal stromal tumors, not ovarian cancer. BCR, ABL is incorrect as this is the translocation found in the Philadelphia chromosome implicated in chronic myelogenous leukemia, not ovarian cancer. You are the nurse taking care of a patient newly diagnosed with pancreatic cancer. Which of the following biomarkers is typically followed to assess the progress of disease, or response to treatment, in pancreatic cancer patients? A. Cancer antigen 125, CA125. B. CD20 antigen. C. Cancer antigen 199, CA199. D. BRAF. E. CD30. The answer is C. Cancer antigen 199, California 199. California 199 is often elevated in patients who have pancreatic cancer, or certain types of colon cancers, and can be used to assess response to treatment and/or disease progression. On the other hand, the other choices are incorrect. Cancer antigen 125, California 125, is incorrect as this is a tumor marker used to track ovarian cancer, not pancreatic cancer. CD20 antigen is a tumor marker for B-cell lymphomas and leukemias, not pancreatic cancer. CD30 antigen is a tumor marker for anaplastic large cell lymphoma, not pancreatic cancer. BRAF is a tumor marker for melanoma, not pancreatic cancer. Which of the following image modalities would be best suited to diagnose a suspected lung cancer? A. EKG. B. Chest X-ray. C. EEG. D. CT scan. The answer is D. CT scan. CT scan is the preferred imaging modality to view a tumor in the lung tissue. A chest X-ray might initially find a nodule or abnormal marking in the lungs, but it must be followed up with a CT scan to be diagnostic. EKG looks at the heart and EEG looks at the brain. You are the nurse taking care of a patient in an oncology clinic who was treated with chemotherapy and radiation therapy for anal cancer. The patient finished treatment 2 weeks ago. Which of the following treatment side effects would you expect to see? A. Fever. B. Pupil dilation. C. eye redness. D. Headache. E. Rectal bleeding. The answer is E. Rectal bleeding. The patient is being treated with chemotherapy and radiation therapy for anal cancer, and is multiple weeks removed from treatment. Rectal bleeding is a very common side effect in patients who recently received radiation therapy to the anus, as numerous blood vessels are treated by the radiation therapy, and the body's immunologic response to radiation therapy also promotes vascular permeability. Rectal bleeding, unless profuse and uncontrolled, is often a self-limiting phenomenon in the setting of radiation, and while troublesome for the patient, does not pose much of an acute threat to the patient's stability. Or radiation therapy for anal cancer. Fever is something that should be taken seriously in any cancer patient, especially one receiving chemotherapy. However, it should not necessarily be expected. It should always be assessed for. Headache is a common side effect in patients actively receiving chemotherapy, often either directly due to the chemotherapy drug itself, or to dehydration as a side effect of treatment, lack of appetite. This patient is multiple weeks removed from chemotherapy though, so headache would not be expected as a treatment side effect at this time. Pupil dilation and eye redness are not typical side effects of chemotherapy or radiation therapy for anal cancer. You are the nurse at an oncology practice taking care of an otherwise healthy 22-year-old male being treated with chemotherapy and radiation for Hodgkin's lymphoma. His chemotherapy regimen consists of doxorubicin, bleomycin, vinblastine, and acarbazine. He is not receiving any other medications. He reports feeling well aside from fatigue, and numbness and tingling of his hands and feet. Which of the following is the most likely cause of the hand and foot numbness and tingling? A. Diabetic neuropathy. B. Posterior spinal cord degeneration. C. Selective serotonin reuptake inhibitor discontinuation syndrome. D. Bleomycin-induced neuropathy. E. Vinblastine-induced neuropathy. The answer is E. Vinblastine-induced neuropathy. This is the most likely explanation for this patient's peripheral neuropathy, as the patient is described as being healthy aside from Hodgkin's lymphoma, and on no medications aside from his chemotherapy regimen. As a result, diabetic neuropathy and selective serotonin reuptake inhibitor discontinuation syndrome can each be ruled out as etiologies. Similarly, given that he is otherwise healthy and not complaining of any additional neurological symptoms, and given that he is young and actively receiving chemotherapy, it is unlikely that he is experiencing posterior spinal cord degeneration. Thus, in a young patient with lymphoma who is receiving chemotherapy and experiencing peripheral neuropathy, the most likely etiology is one of the chemotherapy medications that he is receiving. In this patient's case, he is receiving doxorubicin, bleomycin, vinblastine, and acarbazine. Of these medications, vinblastine is the most strongly associated with peripheral neuropathy, as this is a fairly common side effect of vinblastine and other agents in the same class, vinca alkaloids. As such, vinblastine-induced neuropathy is the most likely etiology.